Greetings, everybody. I am excited to be here. This is week number 3 for 5 weeks Broken Silence Awareness. I am honored. I am happy to have just a medical guru with us today, the none other than Dr. Robin Screen. And today we are going to be talking about healthy living, healthy eating, and caring for your temple. Again, my name is Xavier Sanders, and I am the executive director for the Barbara Cares Foundation. And we are just excited to bring this 5-week series back this year, highlighting every topic, candid conversations as it relates to breast cancer and awareness. And without further ado, Dr. Screen, it is always good to see you. And I have just a couple of questions for you today, and I appreciate you just giving some of your time. And before we get into the questions, if you could just briefly, just for the viewing audience, just explain just a little bit about your background and where you currently, what your practice and what your focus is as it relates to your medical profession.
Good afternoon, Xavier. I'm Dr. Robin Screen, and I'm glad to be here. I'm a breast surgeon, which means I take care of breast cancer patients or other women or sometimes men with breast problems. This includes lumps, bumps, changes in the breast cancer diagnoses, as well as women who are at a high risk for developing breast cancer.
Gotcha. Well, we thank you so much for you doing what you do to keep us safe, and especially for those that are going through a breast cancer diagnosis. And so thank you so much for what you bring to the community as it relates to your profession. I want to jump right in as far as with our questions. And again, our topic for this week is healthy living, healthy eating, and caring for your temple. And the first question I wanted to ask you, Dr. Screen, is as a medical professional, how important is our diet as a way of fighting disease?
Our diet is essential. In fact, I think it's one of the primary things that we can do to impact better health. We always think, okay, my blood pressure is high, I'll go to the doctor and get a pill. My blood sugar is running high, I'll go to the doctor and get a shot. And what we don't think in terms of is, if I can change the way I eat, I won't have to get a pill or a shot. It takes some work, it takes some level of commitment, but it can be done. And my tagline for my patients currently is, don't think in terms of eating less, think in terms of eating more. Eat more fruits and vegetables. You want a diet that is 70% fruits and vegetables.
That's good. That's good. And I love that tagline on there. If I were to ask you a follow-up question, what would be some words of wisdom for those that are struggling as it relates to dieting? I know dieting is typically a word that we try to shy away from, and we consider it, if I could put it in this frame, as a punishment. And so, what would be some words of wisdom and some practical means by which we can get beyond that mindset of it's going to be a struggle, it's going to be a punishment? And how would you approach that for someone that is saying, I hear what you're saying, doctor, but I don't want to do it?
I would say, I'll talk to you from my own personal perspective. I'm 57 years old. A few years ago, I was looking at, turning 55, 60s on the horizon. And what we typically hear in medicine when we're describing a patient, and we tell that patient's medical history, especially in the context of African American. It's an African American female, and automatically she's got diabetes and hypertension. I was on my way to being that woman: overweight, pre-diabetic, borderline hypertensive, high cholesterol. I didn't want to be that. And I didn't want to take those medicines. Don't get me wrong. Those medicines are important and they play a role. And sometimes we need those to get us over that hump. But I had to change how I was doing things. And I've done all kinds of diets in the past. I've done Weight Watchers, I've done Medi weight loss, I've done MediFast. I've not done Jenny Craig, but I've done plenty of. I've done keto, and I have lost the weight, but this time I know it needed to be different. Rapid weight loss is not sustainable because that's usually done through a diet. Mm-hmm. This go round, I did not do a diet. I gradually and slowly changed how I ate. The big things that I have done, and I'll be honest, I did count my calories, but the big things that I did was I changed what I ate. I ate more fruits and vegetables. I strive to have a diet that's 70% fruits and vegetables. I don't eat processed foods. People may ask, well, how do you know what's processed? Look at the ingredients. I always tell people, if they're not in English, then it's processed. Stay away from it. And good. You would be shocked. Foods with added sugar. So we talk about sugar being bad. Naturally occurring sugar is not. So sugar as it occurs in fruit is fine, but sugar added to food is not good for you. And again, you're back to reading that label and those ingredients. So I would say your goal is little by little. I lost 40 pounds, but I did it over 3 years. So that's about 12, 13 pounds a year. That's not 50 pounds every 6 months. And I remind my patients when I talk to them, if you can lose a couple pounds every 6 months, in 10 years, that's 40 to 50 pounds that you've kept off. And one of the things that I did besides thinking in terms of eating more fruits and vegetables, start with the fruits and vegetables. If you want that stuff that you enjoy, save it for later. Get a big old salad, a huge salad, dinner plate salad heaped up. Servings of fruits and vegetables, not one little spoon, do 5 or 6 spoons. What's the harm? There's not that many calories, full of vitamins and nutrients and compounds that are beneficial for you. And some of them are cancer fighting. And then if you want that piece of cake, cut yourself a piece of cake. But by the time you've eaten all that fruits and vegetables, you're probably not going to eat that whole piece of cake. And find substitutes for that stuff you love that's not good for you. I love ice cream. I rarely do ice cream anymore, but my substitute, and it's still a treat because it has a lot of calories, is an acai bowl. Got to watch what's in there. I don't put honey in it, but acai is like a pomegranate fruit. They make a smoothie puree. It's a smoothie bowl. They add all kinds of fruits to it. And then they can add things like hemp seeds, which provide protein and other nutrients, chia seeds. Some people will do granola. I try to stay away from granola because it's got added sugar, but I will add rolled oats to give me that crunch. And that to me satisfies that ice cream craving. So if you love cake, find a way to make a healthy substitute or find a healthy substitute. It's not something you can have all the time, but when you do have it, it's not as bad for you.
I love that, what you mentioned as far as the healthy substitutes. Unfortunately, and you can probably attest to this because you probably hear it often, sometimes our body has those unhealthy cravings. And so in order to address that, it's not in a sense of depriving what your body may or may not want, but what you're doing is you're providing just an adequate substitute. So I appreciate you just saying that if your body is craving something, or if you're thinking something, let me put it that way, if you're thinking that, I want a brownie, try to find a healthier alternative. If you want some ice cream.
Or like I said, pile on the fruits and veggies and then go get that. Probably a spoonful or two of ice cream. You're not going to want much more than that. Or you want that brownie, you'll end up with hopefully a small square. Some things I just can't keep in the house, like chocolate chip cookies.
Right. Let me ask you, Dr. Screen, because there is, and I hear this a lot, even with my mother when she was going through her breast cancer journey, I was trying to keep her away from sugar. I just thought sugar was bad, 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 bad. Can you just revisit that again, that there are good sugars as opposed to some bad sugars? And if you could just kind of elaborate on that for just people that are like me, that are just, whenever you see sugar, no.
Well, naturally occurring sugar is fine. So in fruit, it really is okay. Does that mean you can live on a diet that's all fruit? Probably not a good idea and might get too much sugar, but your body processes that differently than foods with added sugar. So those processed foods, those prepackaged foods, you look at the label, if it says sugar on it, and you would be surprised, Cheerios have sugar. Wow. We think that's a good, healthy thing. You would be surprised at what foods have sugar: barbecue sauce, ketchup, mayonnaise, coleslaw from Chick-fil-A. It becomes essential to read the labels. And that's the thing. You think about God's food, it doesn't have labels. So God's food, you don't have to worry about what you're eating, just enjoy it.
Right. That's good. And thank you for that. I did have one final question for you, Dr. Screen, and it is, as a breast surgeon, This is October, Breast Cancer Awareness Month, and so we certainly want to just provide just some information, some beneficial information as it relates to breast cancer awareness. But as a breast cancer surgeon, what are some signs that women and men should look for and be aware of that would raise flags for you as a medical professional?
Okay. I'm glad you make the point of men as well as women. It is not as common, but men do get breast cancer. For every 10 women that get breast cancer, there is a man that gets breast cancer. And oftentimes that tends to be more aggressive. So these are things you don't want to ignore, whether you're a man or a woman. You want to do monthly breast self-exams. And sometimes that's controversial, but I personally feel that it's beneficial. I've just seen women that have found lumps that turned out to be cancer. 9 times out of 10, it's not going to be, but I've seen it where they discovered it and the mammogram did not. So what I tell my patients is you are looking for a change in your breast. This includes not only what you feel, but what you see. So the key points of doing a breast exam are you start with inspection in the mirror. You want to look at your breast with both hands on your hips and then both hands up over your head. And then you want to do your breast exam, in 2 positions, either sitting or standing and then lying down, because you may feel something in one position you don't feel in the other. Oftentimes we tell women to do their breast self-exams, and it's kind of tough because the first time you do it, you're like, oh my gosh, there's all these lumps. What am I feeling? And most women have no idea what they're feeling. Your starting point should be when you meet with your primary care doctor, your gynecologist, or if you're at high risk or you found something, a breast surgeon. And once they've told you that your breast exam is normal, that's what you know is normal for you. So for the next couple of weeks, every day, and people go every day, it only takes a couple of minutes, but for about 2 weeks, every day, you want to do a breast self-exam in those 2 positions. What you're doing is you're creating a map in your head of what your breasts feel like, the topography of your breast, the lumps, bumps, hills, and valleys. If you do that every day for 2 weeks, you will get that roadmap in your head. Once you have that roadmap in your head, and then you go back to doing monthly breast self-exams, you will know what's normal for you. And what you're looking for is something new or something different. So that can include change in the shape or contour of the breast, change in shape or contour of the nipple discharge, or something that you feel, or change in the appearance of your breast skin.
That's good advice, and thank you for saying that it is important to have that personal roadmap as it relates to, because oftentimes, and you can probably agree with this, oftentimes we are able to know before someone else is able to tell us, but it's important for us to take those appropriate measures to be proactive and to be diligent to do those monthly exams. And I know I said that was my last question, but for any parting advice as it relates to this topic, healthy eating and healthy living, for those that, what would be just some advice that you would say for someone to live healthy, and what would that mean for you?
Healthy living is not just what you put in your mouth, although I think that's 3/4 of it. Healthy living is also getting enough sleep. I remember hearing a talk from a sleep specialist, and basically at the end of every piece of information that she gave us, it was like, if you don't get enough sleep, you die. Sleep is essential for our health and well-being, and we need to find the ways to get enough rest. I just don't have enough time to go into that in more detail. And stress is key in developing not only breast cancer, but other types of cancer. The more stress you have, the more likely it is that you will develop cancer. So we have to do things that mitigate our stress. That can be spending time with family and friends. That one of the things that's essential is spending time in the Word, meditation, and prayer, and other ways that help you de-stress, whether that's exercise or yoga or whatever it may be to help you de-stress. You've got to value yourself enough to find ways to de-stress. One other thing I'd like to add is that healthcare, the face of healthcare has changed. You must be your own advocate.
Yes.
And if you don't feel that you can advocate for yourself, I always tell people, then find somebody who will advocate for you.
Absolutely. And I'm happy that you said that that is nothing but just by God's design that you said that this past week's PSA was your nurse advocates. And so we actually talked about the importance of having someone to advocate for you. And so that is just pure confirmation. And so for those that missed last week's PSA on resources that are available, I encourage you to go back and check that replay and to find out all of the good that your nurse advocates is doing here in the local DFW Tarrant County Metroplex. So Dr. Screen, I appreciate you. And for the viewers that are watching, you've heard from you've heard from the doctor. And so we just encourage you to eat well, live well, and please care for your temple. And in the words of my mother, I'll close with this: continue to fight, continue to smile, and continue to fight some more. Until we talk again next week, this is Xavier signing off. Thank you again, Dr. Screen.